convulsion. Febrile convulsion is mainly two types of febrile convulsions, or it is classified into two types. One is simple febrile convulsion. The other one is complex febrile convulsion. In simple by definition, it usually occurs in an age group of 6 months to 5 years age group. 6 months to 5 years age group it occurs, and it is in generalized tonic-clonic seizures, and it should last for less than 15 minutes. It shouldn't be more than 15 minutes, less than 15 minutes. And there shouldn't be one more episode of generalized tonic-clonic seizures, that is GTCS, in next 24 hours or in the same febrile illness. There shouldn't be any at all. If all these three parameters, what we have discussed, 1, 2, and 3 are present, then only we call it as a simple febrile convulsion. If this definition is not satisfied, then you label it as a complex febrile convulsion. So it is in simple febrile convulsion, what you do. If it is a complex febrile convulsion, if the patient is actively seizing, then we know status epilepticus how to treat it. There's no active seizures are present, but it is in complex febrile seizures, then you go ahead and admit this patient. If it is a complex, you should go and admit the patient. You shouldn't discharge this patient. It requires further evaluations and further management. That's why you should admit in the pediatric age group. What other things, what do you need to admit for? What we said here is a febrile convulsion. Febrile means the patient is having an infection. Because of infection, you might have to admit. So some indications of because of the infections, some indications of because of the complex febrile seizures. Because of infections, or you're not able to find out the foci of infection. Is it because of middle ear infection, or is it because of urinary tract infection, or pneumonia, or meningitis? We don't know. You're not able to figure it out, the focus of infection. Then you need to admit. If the patient is having meningitis, or if there are signs of meningitis, you need to admit. If the patient is in sepsis, you need to admit. So these three are related to the infection per se. Another one which is related to the infection is the patient is already on antibiotics or recently used an antibiotic, then you go ahead and admit. So all these four are related to the infection. The one related to the convulsion itself, if it is complex or prolonged seizures what this patient is having, that is nothing but the complex febrile seizures what the patient is having. Prolonged here by definition is more than 15 minutes. Then you go ahead and admit. Sometimes you might have to admit for the social reasons. If the parents are quite anxious, then you need to go ahead and admit it. Because of the anxiety of the patient, they are the first kid it is, they don't know how to manage it, they're quite tense, then you might. Some trust says first febrile convulsions is better to admit, but it is not an absolute indication to admit. You can still discharge for a first febrile convulsion. If you know the foci of infection, the patient is quite well, the kid is hemodynamically stable, then you can discharge that patient. When you're planning to discharge the patient, the kid is fine, it is a simple febrile convulsions, you don't know the source of infection, you're planning to discharge, the advice is important. The discharge advice is important. Usually parents will have quite a bit of questions because they're quite tense. The kid had a convulsion which is quite frightening for the parents, so they will have questions. The one of the questions usually they ask is, does it cause brain damage? No. The simple answer for this is no. Does this progress into an adulthood? Unlikely. Most of the time it doesn't progress. Chances are very less. It is 1 in 50 which progresses into an epilepsy in the adulthood. If the kid has a fever, what to do? What to do is you can just give a simple paracetamol. There is no recommendation to do a tepid sponging or fanning or cold bath. It is not recommended. There is no point in doing this. It just externally cools the body, but the internal body temperature doesn't bring it down. So this is not the recommendation. This is proven to be not effective in febrile convulsions. Bringing down the fever itself will help the patient to be comfortable. That's it. It doesn't help to prevent the febrile convulsions. You're having a high grade fever doesn't mean that you're most likely, or that is a risk factor to have a febrile convulsion. No, that's not false. If you have a low grade fever, also still you can have an febrile convulsion. So fever, you control it only for the patients, that is the kids comfort wise, not to prevent or not to predispose the patient for seizures. It doesn't happen like that. Fever is only controlled for the comfort of the patient. Make sure they have a lot of fluids, because fever itself will cause a lot of sweating and there will be loss of fluids, and the patient can go into dehydration. For that particular reason, make sure the kid has plenty of fluids. At the same point, if the kid ends up having one more seizures, what to do? Start the time. If the seizures last for more than 5 minutes, get back the kid or call for an ambulance and get the kid back to the emergency department as soon as possible.